Ozark Facial, plastic surgery, and aesthetics help patients put their best face forward with caring, personalized services that help reveal the beauty within. Now, I had the chance to visit with Dr. Spencer and learn all about the services that he and his team provide. Take a look. Hey everyone, I'm at Ozark Facial Plastic Surgery and Aesthetics, and I'm about to go in and talk to Dr. Spencer about all of the services that they offer here. Let's go.
Well, my name is Jared Spencer, and I've been in Northwest Arkansas for 15 years, and this is our practice. It's called Ozark Facial Plastic Surgery and Aesthetics, and we've been here for 15 years, although this is a new location for us. We've been here in Fayetteville since January of 2024. I am a facial plastic surgeon, and so I focus exclusively on the face. And so a lot of what I do can be cosmetic, but some of it can also be functional, and some of it is a combination of the two. But I tend to do a lot of facial rejuvenation procedures. So I help rejuvenate the eyelids, for example, or somebody's face and jawline and neck, or the brows. And so we do all of that from a surgery standpoint, but we also do lesser invasive treatments as well, maintenance treatments to help patients just keep looking their best as we all kind of age, throughout our lives. We really do everything as it relates to the face. We have patients that come in from scars from previous trauma that are bothersome to them, and we can touch up those and have those look as good as possible. Sometimes it can be as simple as a mole that's really bothered somebody that's on their face, and we talk about the options for that. I do a lot of facial rejuvenation, face neck lifts and eyelid procedures, but I also do a lot of noses as well. Nose job is called a rhinoplasty, and some of those are functional, some of those are cosmetic, and a lot of those are a combination of the two. We leave it to the patient to kind of bring their concerns to us, and I let them know my honest opinion of what we can do. So I've been in practice here for 15 years. I finished my fellowship training in 2007, completed a fellowship in facial plastic surgery. And most people don't realize in order to become a facial plastic surgeon, a prerequisite is you need to have a residency training in ENT head and neck surgery. And so I completed that residency training in Rochester, New York, and I'm actually board certified in head and neck surgery as well. But then I completed a fellowship here at Stanford University in facial plastic surgery, and so I'm double board certified. But I focus my practice on facial plastic and reconstructive surgery, and that's really all we do here in our practice. As I was going through my medical training, I really enjoyed suturing and making things look as good as possible. And I was initially kind of drawn to the specialty for some of the big head and neck procedures that were done for patients that had cancer and needed some pretty big reconstructions, and I was amazed at what could be done to help them kind of restore their appearance to the point where they could feel good about things again. And that kind of evolved into the facial plastics field, and I realized that whether we have cancer or not, we all have things that are bothersome to us that we feel like sometimes hold us back, or sometimes as we age we don't feel as that our outside appearance reflects as much how we feel inside. And I discovered that even doing those procedures sometimes gives as much satisfaction and happiness, to patients as even some of the cancer surgeries. And so I was kind of drawn to those, and I find those very rewarding to help patients really just feel good about themselves and feel like they look the best, at any stage of their life. We're basically a full-service facial office, and so really we're known by Ozark Facial because patients can come in for even having a facial for their skin or a laser treatment for their skin, and we have some great nurses that provide those services, and it's really whatever somebody desires at that stage. We recommend whatever we feel like is best for the patient. If there is a less invasive treatment that will help the patient, then that's what we'll recommend. But sometimes surgery is really what's required to help a patient get the outcome that they're really searching for. We have a website called ozarkfacial.com, and they can always look at our website, and we have a full list of services there, and we have a gallery of patients that have allowed us to use their pictures to kind of go through some of the procedures that we do, and they can always call our number as well. We're happy to make a consultation either with me or we have one of our estheticians, depending on what they'd like to do.
It was so great chatting with Dr. Spencer. Learned a lot. So if you're interested, you can give them a call or check their website, but we'll be right back with more Good Day NWA.